What if your next doctor wasn't human? Imagine sitting in a room, your symptoms analyzed not by a person, but by a machine. Within seconds, it tells you what's wrong, how serious it is, and what to do next. No stethoscope, no white coat, just data. Sounds like science fiction? It's not. Artificial intelligence is already diagnosing patients faster, cheaper, and in some cases, better than doctors. But should we trust it or fear it? What is diagnostic AI? AI in medicine isn't new, but what's happening now is on another level. Modern AI can read thousands of medical images in seconds, from MRIs to X-rays, spotting signs of disease that even experienced doctors can miss. Using deep learning, these machines learn patterns from millions of real patient cases. For example, Google's DeepMind created an AI that detects over 50 eye diseases, with 94% accuracy, matching top ophthalmologists. Stanford's CheXNet AI detects pneumonia on chest X-rays, better than radiologists. These systems don't get tired. They don't skip details. They are trained with more data than any human will ever see in a lifetime. Even more shocking, some AIs can flag rare conditions that most general practitioners might only see once in their career, and they keep getting better every time they see new data. It's like having an infinite memory combined with perfect pattern recognition, and that power comes with both hope and risk. Where it's already working, let's go global for a moment. In India and Africa, where doctors are scarce, AI diagnostic tools are literally saving lives. Spotting diseases early, where no expert is available. Small rural clinics are now using apps connected to cloud-based AIs that process patient data instantly. In the US, hospitals are using AI to predict sepsis, a deadly infection, hours earlier than human staff can detect. That early warning can be the difference between life and death. And in China, a system called Tencent Miying screens for cancer and diabetic retinopathy in hospitals, processing millions of patients faster than human teams ever could. In fact, some hospitals have started using AI as a second opinion and found it caught errors made by human doctors. In the UK, the National Health Service, NHS, has started trials with AI in radiology, where AI systems pre-analyze images before a human even looks at them. This not only speeds up the workflow, but prevents dangerous delays in treatment. Across the globe, AI isn't coming. It's already here, reshaping how we detect illness. And it's just the beginning. Can AI really be better than a doctor? Doctors spend years, sometimes decades, mastering diagnosis. But they're human. They miss signs. They make errors. In fact, according to Johns Hopkins, over 250,000 deaths per year in the US are due to medical errors, many of them diagnostic. AI doesn't forget. It doesn't get emotional. It doesn't skip lunch or have a bad day. One study from MIT found AI could detect breast cancer 5 years before it developed by analyzing patterns no human eye could see. In dermatology, AI has reached or surpassed dermatologists in identifying skin cancer through photos. Even in cardiology, machines now read ECGs with near-perfect precision. But here's a twist. AI lacks intuition. It doesn't sense when something is wrong the way an experienced doctor might. It only works if the data is clean, correct, and complete, a rare thing in messy real-world hospitals. So yes, AI might outperform humans statistically, but that doesn't mean it understands humans. And that's a crucial difference. The dangers and predictions warning signs exist. An AI trained on biased data may discriminate without realizing it. If the dataset lacks diversity, the AI may misdiagnose women, people of color, or rare conditions. Also, who's responsible if the AI is wrong? The company? The hospital? The doctor who approved it? If a patient dies because of an AI error, can anyone be held accountable? These are not science fiction questions. They're already being asked in real hospitals. Another threat is data privacy. Diagnostic AI systems often rely on massive patient datasets. But what if that data is hacked or used for profit by tech companies? Experts say in the next 10 to 15 years, AI will be commonplace in diagnosis, especially in rich hospitals. But full trust in AI? That might take much longer. Some futurists even believe we'll have personal AI doctors in our phones, analyzing everything from our sleep patterns to voice tone. It's a powerful vision, but also a potentially dangerous one. Will doctors be replaced? The truth is, AI won't replace doctors, but doctors who use AI might replace those who don't. Think of AI as a super assistant, scanning, flagging, predicting, and giving the human doctor tools to make better decisions. In fact, the most successful hospitals of the future may not be those with the best human doctors, but those where humans and AI work together seamlessly. Already, medical schools are teaching future doctors how to work with AI systems. They're being trained not just to diagnose, but to interpret AI results, check them, and explain them to patients. Ethics, emotions, spirituality, and human care can't be programmed. At least not yet. Only humans can build trust, give hope, or deliver bad news with compassion. So, maybe the future of medicine isn't about choosing between humans and AI. It's about making them partners, for the good of us all. So, would you trust a machine with your life? Or would you always need a human voice behind the screen? Because the future of medicine might not come with a heartbeat, but it could come with something even more powerful: